they improve the roads. Maybe they build more community health centers, provide free vaccinations, free tests. Maybe free C-creative protein tests in those community health centers in the neighborhood. You can change the relationship. You can change this relationship. That's what page 6 of your book is arguing about. And the second way to change this relationship, to equalize things, is to change the flexible resources in a given neighborhood, or in the families within that neighborhood, or among the individuals in that neighborhood. So your book provides some examples about the key flexible resources: knowledge, improve people's health literacy, money, maybe job creation initiatives, encourage maybe factories, companies from other places in the US or from other countries to come to invest maybe in that bad area in Baltimore, clean up that area in Baltimore. Government has to be involved, has to be very involved to change this relationship. Power. Sometimes the residents in those neighborhoods, they have to have some sense of agency, autonomy. I think agency is almost similar to autonomy. They have to feel that they are part of the neighborhood, they are being engaged in the affairs of the neighborhood. If government making decisions up there on top, and they don't solicit feedback from the residents in that neighborhood. They say, what do these people know? They are illiterate and they are on government assistance. We just make our decisions. And maybe the residents in that neighborhood, they may feel left out. They don't feel a sense of belongingness to that neighborhood. And they may not cooperate with the government. So people who live in the neighborhood, not only policymakers, not only the higher ups, they have to have a sense of power or a sense of agency in order for change to happen. Yes, you can change this relationship. And prestige. Yeah, there are many ways to increase the prestige of a given neighborhood. So have you heard of this place? The Soho Street in New York. Have you heard of the Soho Street in New York? So in, I think, 1949, the Soho Street in New York was very similar to what you saw in the video in Baltimore, that area in Baltimore. Wow, it was filthy, trash were everywhere. And it started from one resident. Apparently, he was an art lover too. I forgot his name. So he started a movement on that street in his own community, maybe with his neighbors. He cleaned up the streets. So it was a bottom-up approach. He cleaned up the streets in that neighborhood. So after everything was clean, it started from people in that neighborhood. They did not ask any help from the government. So they cleaned up the streets and other parts of the town, other aspects of the town. So eventually, Soho streets became more livable, more presentable to outsiders. And people start to come to Soho Street to open art galleries, to invest, to open restaurants. And now Soho Street is one of the somewhat more prosperous area in New York. So it's a bottom-up approach. It started from a few residents who think that we need to clean up the trash. So when they did that, they increased the prestige of that neighborhood through a bottom-up approach. And yeah, you need to have some social connections to improve things. So if there's a good connection between the residents of the community and the policymakers, the government practitioners, things can happen. So inequality in this phase can be eliminated, it's going to change people's health behavior. It's going to change people's cognitive and non-cognitive skills. Maybe more access to certain tests, certain scans, including the C-reactive protein. And health gaps are going to be closed eventually. So, on page 7 of your book, so another way to change this relationship, the bottom part of page 7, is to identify the factors that put people at risk of certain health behaviors or access to dangerous environments, to identify those factors that put people at risk and attack those factors. Like the video we just saw, the factors that put people at risk would be the lack of transportation system. People had to take buses. Or maybe a lot of unhealthy food chains in those neighborhoods, a lot of fast food restaurants, a lot of places that sell processed food. They do not sell healthy food. Those are the factors that put people at risk. A lot of places that sell liquor. So if government identify those, and through certain interventions, certain campaigns, they target those factors. They convince those people, the residents in that community, telling them in their layman's language, these are the factors that can put you at risk of certain health conditions. And you have to change. And we are going to help you. Maybe they provide certain subsidies, easier ways to change. Yes, you can alter this relationship. So, page 6 to 7 of your book suggests 3 ways that can be used to alter this relationship. And one question for you. Are wealthier people always healthier? No, I think I asked you this question before. So if you turn to page 8, no. Sometimes wealthier people can be more unhealthy. And page 8 gives one example about sometimes high SES women. When they have high socio-economic statuses, they tend to have more income, more resources, more educated. And they may have other obligations that compete with their demands, family demands. Sometimes they postpone prolonged childbearing, or they don't have children at all. But some of these highly educated professional women, they postpone childbearing. And when you have a children, if you Google that, in your late 30s or early 40s or in your 40s, it can lead to various health implications. And your book identify one of them, breast cancer. Breast cancer can be due to late childbearing. And another example would be peripartum cardiomyopathy. You don't have to know this one. I think I spelled it right. So, this condition is also due to late childbearing. It's a kind of cardiological complications, cardiac complications. When you have these complications, your heart muscle cannot pump blood properly. And according to researchers, medical researchers, it's due to late childbearing. So sometimes, if women, they postpone childbearing, but they still want to have a kid, they can develop breast cancer or this peripartum cardiomyopathy. And because of that, sometimes high SES folks can have worse health than low SES folks. Maybe low SES folks have less competing demands. Maybe they start their childbearing in the normal age range. They can avoid all these things. And it's the same for men. Maybe we see all these products if you consult Dr. Google, if you turn on your TV, all these products, we don't know whether it's true or not, that claims that they can strengthen prostate health. They can make you grow taller. But like I mentioned last week, sometimes we don't know. It's not even disclosed. Companies always say that it's proprietary, it's confidential. We are not going to disclose it. We don't know how these products were tested in the labs, in the companies. So sometimes maybe men with more resources, they may be more likely to purchase, more likely and able to purchase these products, maybe to strengthen, enhance their prostate health, and maybe to get taller. And they may develop certain complications as a result of consuming these products. So these are two examples of how sometimes wealthier folks can be more unhealthy than poor people. Do you know what is omega-3? Have you heard of omega-3? Is that good for you?
Yeah.
Okay. But you are in college, so you are somewhat highly educated. Do you know, among your friends, did you observe, are they aware of omega-3, the benefits of omega-3, among your family and friends?
Yeah.
Are you aware of omega-3? Oh, that's good for you. If you Google omega-3, I'm not making this up. Do you know what's the percentages of Americans who consume omega-3 on a daily basis? Take a wild guess. What's the percentage of the people in your country that consumes omega-3?
20.
It's way below that. Take another guess.
10.
It's close.
7.
7.8. So as you can see, many people are not aware of the benefits of omega-3. So this is another example of why sometimes high SES folks may not necessarily be healthier. And do you know, sometimes certain natural disasters like the Irma, Jose, Harvey, or even Katrina in the past can lead to certain health implications. Yeah, we all know, after a certain disasters, sometimes there are certain sewage, maybe soil or debris or certain food stuff that floats around the water, am I right? After the storm. And this can lead to parasites and bacterial infections. And sometimes how people cope with these potential dangers depends on the social conditions, the characteristics of the neighborhood. If it is a suburbs, maybe people in those neighborhoods are more educated, they are more aware, even though they cannot prevent that, they know. But maybe they are more able to take precautions, they know. Yeah, after all these big storms, our water is not going to be clean. We are going to see sewage and soil and debris in our water, drinking water. Maybe they stock up maybe cans and bottles of water before all these things happen. They may be more able to take precautions according to the fundamental theory, fundamental cost theory. So policymakers, practitioners who focus on the fundamental cost theory to solve problems, they may be aware. People in certain neighborhoods, maybe like that neighborhood you saw in Baltimore in the video, maybe people may not be that aware. So sometimes government, we have seen that before, after all these storms, they may ship tons and tons of clean water to those neighborhoods. They may make people in those neighborhoods aware that, yeah, don't drink all this water after the storm. They may educate people in that neighborhood. And have you heard of this word? Amoeba, am I saying it right? It's a kind of bacteria, am I right? Amoeba, am I saying this right? Okay. So this bacteria always comes up surface after a big storm like Harvey, Irma. And because after all this big storm, there are a lot of standing water, we all know that. Due to the pipe being static, not moving, all the flood water. And it can cause a morbid infection. But maybe middle class people, more educated people in a given neighborhood, they may be already aware, yeah, after all these big storms, we may have a mobile infection, and they may take precautionary measures to prevent them from getting this thing. But people in certain neighborhoods, poor people, they may not be aware that the amoeba virus, I think it's a virus, not a bacteria, I'm not sure, may surface after a big storm. And we all know that sometimes after a big storm, it can affect people's relationship with friends, with family members, with spouses. Sometimes the way we cope with storms is a stressful situation. Sometimes storms affect our relationship patterns. And people from different socio-economic backgrounds have different coping abilities. And this is one article. It's on the week 6 folder. You can read it on your own. Yeah, it talks about how Katrina affects marital relationship, intimate relationships, parent-child relationships, or relationships with other kin. So, people from different SES background, sometimes they have different cognitive and non-cognitive skills. They have different personality traits that affects their coping abilities due to these storms. Some cope better and they don't lash out as much on their family members or their friends. And some do not cope as well and they do certain things. And sometimes we all know relationship patterns can also affect health outcomes. If your relationship is not good with co-workers, with friends, with family members, in the long run, it can affect your health. So, do rich people or poor people have better marital relationship? Is marital quality better among the rich people or the poor people? Do you know? It's a general question.
I don't know.
Okay, you don't want to guess. Do rich people have more marital problems or poor people have more marital problems? I don't know. That's why I'm asking you.
I don't know. I can see it going both ways.
You're right. Okay, we are heading towards the right direction. So, do you use your IQ to maintain a relationship with spouse, with friends, with colleagues, or you use your EQ to maintain a relationship? Do you know? IQ would be analytical abilities, creativity, practicality. Those are the three main aspects of IQ. Do you use your IQ to maintain a relationship, or do you use your EQ to maintain a relationship? EQ would be your ability to understand others, your awareness of others' emotions. You adapt to those emotions accordingly. Because of that, you are more able to work with others, to cooperate with others. You are more able to empathize. That's EQ. When you are aware of others' emotions, how others will perceive or take a given issue, you exercise more self-control. So those are the main aspects of EQ. Ability to understand others' emotions, ability to exercise self-control, and social skills. So as you can see, if you Google it, IQ and EQ measures different aspects of intelligence, right? So do we use more IQ or more EQ when we maintain a relationship?
EQ.
Maybe. So you're right. Maybe because of that, it can go both ways. Poor people, if they don't use their EQ well, they can have bad marriages. Rich people, if they don't exercise their EQ well, they can also have bad marriages, bad relationships. And if you go to page 14, it talks about non-cognitive traits somewhere in the first paragraph. So non-cognitive traits would be our level of perseverance, motivation, time preference, risk aversion, self-esteem, self-control, preference for leisure. And sometimes the social conditions, if you think from the fundamental cause perspective, social conditions, a person's socio-economic levels, a person's level of education, a person's family characteristics, whether it's highly educated family or wealthy family, can lead to different cognitive traits. Maybe certain traits of the parents based on their education level of resources and whatnot. They can teach kids differently in terms of all these non-cognitive traits, and this affects the health behavior of children when they make decisions about health, whether I want to smoke to look cool or I should be more health conscious, whether I want to abuse substance or not, non-cognitive traits, and whether I should persevere or I should fulfill my immediate pleasure, self-gratification. So all these are non-cognitive traits. And a person's non-cognitive traits can also lead to a person's health outcomes. So policymakers who focus on the risk factor model, they neglect the social conditions. They just target the non-cognitive traits. Let's improve a person's non-cognitive traits to various preventive initiative, workshops, interventions. And let's see if their health outcomes improve in the long run. So I think I'm done with chapter 1. Any questions? So I'll see you on Wednesday and we'll talk about chapter 3, I think. So have a good day.